as we already know, androgenetic alopecia, also referred to as male pattern baldness or female pattern baldness, is characterized by two events. One is a shortening of the anagen phase of growth, and secondly, by shrinkage of the shaft diameter of hair, also called as miniaturization. As far as severity of androgenetic alopecia goes, it is classified in men using the Norwood Scale, and in women, the Ludwig scale classifies the severity of baldness. We all know that. However, these classification systems of male and female pattern baldness have a shortcoming. These systems of classification overlook a large form of androgenetic alopecia, which can be called as diffuse alopecia. Now, diffuse alopecia can be of two types. One is diffuse patterned alopecia, and the second one is diffuse unpatterned alopecia. So since these increasingly comprise a large percentage of the patients that we now see on day-to-day basis, therefore I felt a talk on DPA and DUPA was important for my viewers. Now, DPA and DUPA are also androgenetic alopecia. What is androgenetic alopecia? Androgenetic alopecia, due to the genes that you're dealt with, that you've got from either side of your lineage, your mother's side or your father's side, these genes predispose the papilla part of your hair follicle to DHT, dihydrotestosterone, which is a metabolite of testosterone. Testosterone converted by 5-alpha reductase into DHT affects the papillae where the DHT receptors are situated. Once DHT reaches the DHT receptors in the papillae of the hair follicle, it cuts off the blood supply. And once it cuts off the blood supply, the follicles wither, they shrink, and slowly, gradually, they die off. This is the causation of androgenetic alopecia. And as in androgenetic alopecia, also in diffuse hair loss, that is diffuse pattern alopecia and diffuse unpatterned alopecia, the same mechanism of action, the same pathophysiology applies. However, it is to be noted that in diffuse hair loss, not all the hair falls off. You are not slick bald. Hair will continue to exist. It will be thin, friable, brittle, but it is not slick bald. The blood supply that is cut off in DPA and DUPA is not as much as in pure androgenetic alopecia. Therefore, the hair are thin, wispy thin, they are brittle and friable, but they are there. There's a fuzzy growth all over the head. It's not slick bald. This is one of the differentiating factors between typical androgenetic alopecia and DPA and DUPA, which also fall under the category of androgenetic alopecia. Now, why do we want to know about DUPA and DPA? What is the reason we are discussing it now? Why? Because DPA and DUPA respond very well to medication. If detected in time, DPA and DUPA can be reversed. Diffuse pattern alopecia is very much amenable to hair transplant surgery, whereas DUPA, that is diffuse unpatterned alopecia, almost never is. So let us know more about them individually. First, we discuss about DPA, that is diffuse pattern alopecia. Diffuse pattern alopecia is an androgenetic alopecia in which there is diffuse thinning over the hairline, over the top of the head and the crown. This entity, DPA, does not pass through the typical stages of Norwood Scale, as commonly happens in androgenetic alopecia. What differentiates it from DUPA is that a clear-cut donor zone, a defined donor zone, is retained. And this donor zone is permanent. It may be thin, but it is permanent. Also, the hairline does not recede significantly. It is mostly found in men. Women are generally immune to developing diffuse pattern alopecia because of their hormonal makeup. They are immune to the effects of testosterone on the hair, relatively. So what is the differentiating features between androgenetic alopecia, that is typical male pattern baldness, and DPA? Well, the miniaturization of the hair is not complete. That is, it's not slick bald. The hairline is more or less similar to normal hairline. The pattern of baldness does not follow the typical Norwood scales. And the donor area that is the permanent zone, is also thin. It is unlike that in androgenetic alopecia, where it is in very good health. Now coming to DUPA, that is diffuse unpatterned alopecia. Diffuse unpatterned alopecia is most common in women. It is not so common in men. The DUPA progresses very rapidly and forms a horseshoe pattern of baldness, leaving a donor zone which, though thin, is present and is relatively thicker than the miniaturized zone. However, this donor zone is see-through. It lacks density. The hair are wispy thin, making it not fit for a hair transplant procedure. So the most important differentiating point between typical androgenetic alopecia and diffuse pattern alopecia on one hand and DUPA, that is diffuse unpatterned alopecia, on the other is that the donor zone from where we harvest grafts is not stable, is not permanent in DUPA. So this has a reflection on the treatment in these three entities: androgenetic alopecia, typical, DPA and DUPA. DUPA patients do not respond to hair transplant, so they will only respond to other medical treatments, and therefore the differentiation in this talk. So what are the treatments available for DPA and DUPA? Both the forms, if detected early, as they can happen as early as during the teens, and if given medical therapy in the form of finasteride, that is Propecia, or minoxidil, that is Rogaine, most of the hair loss can be relatively reversed, and they respond very well to DHT blockers like finasteride, Propecia, and hair growth stimulants like minoxidil. Therefore, it is very important to detect, diagnose DPA and DUPA in time, since these are good responders to medication. While DUPA is not a candidate for hair transplant because of the unstable donor zone, DPA, that is diffuse pattern alopecia, in most cases is a candidate for hair transplant surgery. So these are the differentiating features between DPA and DUPA, and how these two entities, which do not find mention in Norwood Scale or Ludwig Scale, differ as far as their management, as far as their progress, and as far as their future outcome is concerned. I hope you liked the talk. Thank you for watching. I'll soon be back with the next video.